Hello, and welcome to my informational slidecast on superficial bacterial infections, diagnostics, and treatment options. So, what is a superficial bacterial infection? Well, it is the introduction of bacteria just beneath the skin, where it is allowed to grow and prosper. And the symptoms that we most often feel is an autoimmune response. It's our body trying to fight off the infection. So, what can cause these superficial bacterial infections? Well, if we have already opened up our skin and come in contact with an infected surface, the bacteria will often jump from the surface into our skin where it can actually grow and live. The same will occur if you have opened up your skin and come in contact with an infected person. Or more often, if you have placed the infected or the open wound in your mouth, which we often do in an effort to clean the wound. Or more often, we pull a hangnail out of our finger with our teeth, and the bacteria that is in our mouth jumps from our mouth into our skin and causes the infection. So, what are the symptoms of these superficial bacterial infections? Well, the first sign that we get is swelling of the area. Because of the influx of white blood cells from our autoimmune system to fight off the bacterial infection, we often swell. The area, because of this swelling, the area will often become tender to the touch and often feel warm. The last sign is a visible development of a pocket of pus within often the center of the infection. And what that pus is a mixture of the white blood cells, the dead bacteria, and dead skin cells often enough. So, once we've decided that we have a superficial bacterial infection, what can we do about it? Well, the first thing, if you're trying to fix it at home, is to soak the infected area in hot salt water. Basically, as hot as you can get it. If you cannot get the area into a salt water bath, simply take a hot towel, soak it in water and salt, and place it on the infected area. Next, once the skin has gotten soft enough from soaking it in the hot water, you can drain it if the pus pocket is visible. Next, you want to rinse the area with rubbing alcohol or hydrogen peroxide to kill any of the surface bacteria. And then you can coat the bacteria with an antibacterial cream for obvious reasons, and then bandage the area to keep any more bacteria from entering the wound. So, when should you see a specialist? Well, if you experience nausea, dizziness, or vomiting, then you should definitely see a specialist, because what this means is that the bacteria has actually spread from the wound into the bloodstream. If the infected area is larger than a dime, meaning that it's spreading, if the infected area doesn't get exponentially better after 2 or 3 days of home remedies, because often this means that you will need to be put on an antibiotic treatment. Obviously, if you are in an unbearable amount of pain, and if you accidentally rupture the pocket beneath the skin while trying to drain it, that is an obvious reason to go see the doctor, because it will spread even further. I hope very much that this has helped lead you in the right direction, and if not allowed you to be cured, at least able to see a specialist.